Top exercises for managing diabetes. Managing diabetes doesn't have to be overwhelming. With the right exercises, you can take control of your blood sugar, improve your health, and feel better every day. In this video, we'll explore the top exercises that are proven to help manage diabetes effectively and safely. Whether you're a beginner or an experienced fitness enthusiast, there's something here for you. So, let's First on our list are aerobic exercises. These are fantastic for improving cardiovascular health and boosting insulin sensitivity. Walking. Walking is a low-impact exercise that anyone can do. Just 30 minutes a day can lower your blood sugar and improve circulation. Cycling. Cycling is another great option, especially for those who want to protect their joints while getting their heart pumping. Swimming. Swimming is perfect for a full-body workout. It's gentle on your joints and helps build endurance. Dancing. And let's not forget dancing. It's fun, social, and burns calories while lowering blood sugar. Section 2. Strength training. 2 minutes. Next, we have strength training. Building muscle helps your body use insulin more effectively and improves your metabolism. Bodyweight exercises. Simple moves like squats, push-ups, and lunges can be done anywhere and are highly effective. Resistance bands. Resistance bands are easy to use and perfect for beginners. They help strengthen your muscles without straining your joints. Light weightlifting. For those with experience, light weightlifting is an excellent way to build strength. Focus on exercises like bicep curls or bench presses. Flexibility and balance, 1.5 minutes. Flexibility and balance exercises are often overlooked, but play a crucial role in managing stress and improving overall mobility. Yoga. Yoga helps reduce stress, which can directly impact blood sugar levels. It also improves flexibility and muscle tone. Try simple poses like the warrior pose or downward dog. Tai Chi. Tai Chi is another fantastic option. This gentle flowing exercise improves balance and reduces stress hormones. High-intensity interval training, 1 minute. For those who prefer shorter, intense workouts, high-intensity interval training, or HIIT, is a game-changer. HIIT involves short bursts of intense activity followed by rest. For example, sprint for 30 seconds, then walk for 1 minute. Repeat this cycle for 15 to 20 minutes. It's time-efficient and highly effective for improving insulin sensitivity. Everyday activities, 1 minute. Not a fan of structured workouts? No problem. Everyday activities can also make a big difference. Gardening, household chores, or simply taking the stairs instead of the elevator are great ways to stay active without formal exercise. Before you start any exercise routine, it's important to stay safe. Here are a few tips. Monitor your blood sugar before and after exercise. If it's too low or too high, adjust accordingly. Stay hydrated and carry a snack in case of hypoglycemia. Wear comfortable, supportive shoes and inspect your feet regularly to prevent injuries. Finally, consult your doctor before starting any new workout routine, especially if you have other health conditions. Call to action. 30 seconds. Now that you know the best exercises for managing diabetes, it's time to take action. Start with small steps, be consistent, and listen to your body. Let us know in the comments which exercise you'll try first, and don't forget to like this video and subscribe for more health and fitness tips. Together, we can make fitness a way of life.